Thank you to Desert Financial Credit Union for sponsoring the KRIM Community Spotlight Program. Happy Wednesday, everyone. I was about to say Tuesday, but no, it is Wednesday, hump day, middle of the week. So I hope you guys are having a wonderful week and enjoying the weather. It's warming up a little bit, but still, it's been a mild June, and it's been so beautiful here in Payson, in Rim Country. So hopefully you're able to get out there and enjoy yourself, especially on the weekends. Have our farmers market that has started up right here in the Sawmill Crossing parking lot, and also our concerts in the park. So concerts in the park, a lot of fun. If you haven't been out there to Green Valley Park, concert starts at 7 o'clock, goes until 9. Great music, so hopefully you can get out there. Well, this morning we have Banner Payson Medical Center as our guest, and we have Banner in on a monthly basis to share with all of our listeners and viewers you might be watching on our KRIM FM Facebook page about services that are provided and also new services being brought to Banner Payson Medical Center. So this morning our CEO Hoyt Skabelund is joining us in the studio. Good morning, Hoyt.
Good morning. Thank you for having us, Chris.
Hey, thank you so much for coming in. And telephonically, on the telephone, we have Dr. Jarrett Latham, and he is a pain management specialist, and he's joining us on the phone. Good morning, Dr. Latham.
Good morning. How you doing?
Doing great, doing great. Now, again, where are you located?
So our location coming to Banner Pain Management Clinic will be off East Main Street by Banner Hospital.
Mm-hmm.
Currently calling in from Gilbert, Arizona, by where I live.
Hey, there you go. So just down the hill.
Just down the hill, not far away at all.
Yeah, hey, that is good. So I guess could you start off by telling everyone a little bit about yourself?
Yeah, sure. So I'll kind of start where I grew up. So I grew up in Avon, Connecticut, and after growing up there, I went down college to Florida in Tampa to play baseball. And then I came back to Connecticut. I worked with a general and thoracic surgeon for several years before going to medical school. And I went out to medical school in Colorado, which is where I met my wife as well in medical school, Ashley. And from that point in medical school, I went to Penn State for a residency and for fellowship afterwards in interventional pain management. And from that point, my brother, who's also an anesthesiologist, and my wife, I visited my brother in February out in Arizona, and boy, oh boy, once you do that, it's hard to say no. So we ended up moving out to Arizona in 2017 and have loved it ever since. We've been in the East Valley. We've also went up to Payson and Pine area many times, so a little bit of a familiar area, but love it very much, and we're very excited to come by with Banner and Payson and help provide some of these interventional pain management services we're going to talk about today.
Well, and you mentioned Penn State. I'm from Pennsylvania, from the eastern part of PA, but growing up, rooted hard and still do root hard for the Nittany Lions. So,
Yes, sir.
yeah, you said Penn State. Wow. And then also, I saw you are a DO, so a doctor of osteopathy. And maybe for listeners that don't know the difference between an MD, medical doctor, and a DO, can you just briefly explain, what the difference is?
Yeah, sure. So similar application process, and when you see a difference between a DO and an MD, it's important, one, to understand that the initials come from medical school.
Mm-hmm.
Oddly enough, not from residency and training, which you would think that's where it comes from. So it comes from the initials from medical school, and we do all the similar training as the allopathic or MDs that you call, but we also do a lot of focus on the musculoskeletal system. And treating the body as a whole, body, mind, and spirit, as a foundation of learning the same information. And after performing completing osteopathic medical school is when I transitioned over to allopathic or MD training at Penn State. So when I talk to patients and they ask me, I say, well, I'm a little bit of a crossbreed because I had to do licensing in both board applications and go through both processes, so I can speak to both very well. I kind of biased saying, hey, I think it's the best combination between the two, not that it was planned that way, but how it developed and the learning in the process. So I'm very grateful to have training in both areas, and along with great training in residency and fellowship and a lot of support, a lot of great teachers. So hopefully that answers your question.
Oh yes, and I thought it is interesting because I worked for a doctor who was a DO as well, but received his MD, and he explained to me as well just the benefit he felt, the benefit of being a DO and the additional schooling and training that he received. So, and I don't think most people are aware of that. So that is good. So, Hoyt, this new service that's going to be provided, new department really, is it up and running right now, or is this?
Great question. Let me provide you some history and how we were introduced to Dr. Latham and his team. Upon my arrival here just under 3 years ago, began meeting with physicians amidst the pandemic, so it wasn't as I wasn't able to meet them as quickly as I wanted, but as I met with physicians and nurse practitioners and PAs in the community, I asked what are the greatest areas of need that we don't have services to provide to meet. And in the top three, always and often number one was pain management, chronic pain management. The medication, which we've learned from Dr. Latham today, medication management of pain can be complex and we have to balance potential addictions that can come from those medications that are very effective at managing pain, but they can have side effects and cause other challenges. And so family medicine physicians and internal medicine physicians and providers are often hesitant in managing medications. There's been new state regulations and guidelines, and it's become complex and somewhat burdensome for those that are not trained as Dr. Latham is as a specialist. And so for those reasons, and the other reason is given the demographics of our population, we have, the average age is near 60 in Payson, and so you put 400,000 miles on a body, you're going to start to feel some pain and strain and stresses, and then of course injury due to industry, employment, and work and accidents. And so with that, there's a great demand, and people are having to travel all the way to Phoenix. There's been pain specialists that have come and gone with attempts at offering a clinic, and so we began to look for a partner and explored several groups, and eventually met Dr. Latham's group, Advanced Spine and Pain, in Phoenix in the Valley, and they work with Banner Banner's surgery center partner, and are very revered and respected and for their high quality. The Banner network appreciates contracting with Advanced Spine and Pain because of their expert work and the success they have with patients and the care and how careful they are. So that led us to meet with the COO of the Chief Operating Officer, Keith Ricker, and we worked out a contract that it's taken some time. We want this contract to be sustained in the foreseeable future, to be partners long-term at Payson. And so Dr. Latham is the assigned and selected physician that we get to have here. He'll be the face of our pain management service. We're going to locate this. Dr. Latham will be practicing in the clinic out of our orthopedic clinic there off of East Main Street. And so that's where he'll be going. Let me quickly give a number before I forget, a phone number. If a listener or a family member of a listener or a friend that you know of suffers chronic pain, etc., or is seeing pain specialists and having to travel a great distance to Flagstaff or other locations, To schedule an appointment with Dr. Latham, you would call 928-596-4800, 4800. Again, that's 928-596-4800. That's the orthopedic clinic phone number. And Dr. Latham's first day of clinic will be on Monday, July 24th. And thereafter, his clinic days will be the first and third Monday, starting on a fourth Monday, but it's going to be thereafter typically be holding clinic on the first and third Monday of the month. And with the exception of Labor Day, obviously, it's a holiday, it will be closed. And then as volume dictates, Dr. Latham will be joined by his team of providers, nurse practitioners and PAs that he will oversee, and hopefully hoping that Dr. Latham will be able to perform the procedures that he's specialized in our hospital operating room to help provide pain relief when medication and other therapies are not adequate. And Keith Ricker and Dr. Latham and team have expressed that if the volume of need in the community dictates, we would increase that to every Monday. Mm-hmm. And then if we had a need beyond that, we would look at adding other days of the week. So those are kind of that's the background. Very long answer to your short question. That's the background. Not open yet, but will be open July 24th. We're accepting phone calls and referrals. Patients can self-refer or physicians can refer them and begin the assessment. So.
Gotcha, and I posted that on our live feed, put the phone number down to Dr. Latham's office. So if you want to schedule an appointment or be referred by your doctor, that number is on there. Again, and you might have said this, but how long now have you been providing services, Dr. Latham?
Yeah, I've been providing interventional pain management services in Arizona since 2017. And so when I originally came out, I joined a group, and then what Hoyt had mentioned before is we noticed that patients weren't receiving the right care, and we wanted to make a change to that and really focus on the patients. And when we started our group, Advanced Spine and Pain, it got busy very quick. And we had a lot of growth, a lot of great staff, great physicians behind all of this, just a lot of support to put us in a successful position. And we continue to do that, and we started in September 2020 with Advanced Spine and Pain and have grown the clinics all throughout the valley. And we noticed one location when we met with Hoyt and Banner Medical being so gracious to form a team here and provide great services in Payson. We realized that there was such a need for this. I had so many patients drive over to the East Valley, and to them they say, oh, well, I just drive an hour and a half, and I'll say, geez, it kind of makes me feel bad. I say, we should go up there and provide services up there for patients with pain. And when patients say, well, how do I know I need to go to a pain clinic? I think that's one of the main questions, or what exactly do you do? So I think the short answer is, if you have pain, come to the pain clinic. What consists of pain, whether it's something that was acute, recently happened, where someone threw out their back or shoulder, hip, any location of the body, or if they've had chronic pain of the spine or neuropathy, a nerve type pain, or joint pain of the shoulder, hips, or knees, patients who suffer from diseases or cancer. All these are under the umbrella of pain, and there's various ways to treat them. So a lot of work, what we do is procedures under live X-ray or fluoroscopy to help treat these conditions. And when patients come into the clinic, we'll get a full history and physical exam. We'll obtain the appropriate imaging and labs and tests we need to help diagnose. And then once we diagnose and have a target, we talk about treatment. So whether that's something procedurally to get off of pain medication, or if it's a regimen that consists of medication management with some sort of procedure to help reduce their pain, we're there to encompass all pain treatments on the spectrum from I just got this pain to I've had this pain for 30 or 40 years. So I think it's important for patients to know that we're here to help them. And if they say the word pain, then please come by and let us help you.
Mm. And it sounds like you would be working closely with the physical therapy department then as well. Is that accurate?
Correct, yeah. So when we see patients, we always discuss initially conservative care like physical therapy and or chiropractic care, acupuncture, all the conservative therapy. And if patients come in and we follow them along and say, hey, this isn't improving, what's next? I have some medication, but I don't want to be on these medications. I want something else to help reduce my pain. And that's really the roundhouse. And there's no right or wrong time to come see us. If patients haven't performed physical therapy, but they have some pain going on, I'd say at a minimum, help find them a diagnosis and a reason why they have the pain. And that way there's a better trajectory and a treatment plan for our patients to do well and to follow them along to make sure that they know we're there for them. And that if they get relief at any point in the process, well, fantastic. That's what we're looking for. It's really about improving quality of life for our patients. And, if you have pain long enough, and I think we can all attest to this, it can start affecting the mental component or behavioral health component as well. So, we're here to help you, and come on by if you have pain.
Mm-hmm. And really just thinking back to previous guests from Banner Payson Medical Center and how all of the departments working together, because with the physical therapy techs that have been in and talking about their role and who they serve. Also the young lady or woman who, mental health.
Yeah.
For mental health, because as Dr. Latham just said, that when you're dealing with chronic pain or have had pain for a long time, then you can start being depressed. And there's other mental issues that can stem from that also would probably want to be addressed or at least looked at during the treatment process, because again, I like how he mentioned, Dr. Latham mentioned, mind, body, spirit, the whole body, and treating the entire person and not just, one area or a symptom, but, really treating the entire person.
We're excited about adding this resource, an incredible resource, and that is rare in rural settings.
Mm-hmm.
For Dr. Latham to hear him say, I feel bad, I wish we could come to them, is so powerful. In rural settings, it's rare to have a pain specialist, interventionalist available. And so this will be an opportunity to leverage all the different services in the healthcare network in Payson. And there'll be times when there may be resources that have to continue to be obtained in the valley, but we hope that those are limited, and we're always going to be looking to grow. Where's a need that we can sustainably grow to meet? I'd be interested to hear Dr. Latham, and anxious for this visit today and future visits. Can you tell us? Can you teach the general listening audience, including the two of us, what is the cause of most pain, or what is there categories? Is there a way to give us in 5 to 7 minutes, an overview of pain and interventions, or that's maybe a tall order?
Yeah, I could talk about, so the pain is a very interesting topic, because if you look at it from a very primitive standpoint, pain is a protective mechanism for most things. The stove is hot, don't touch the stove or you get injured. But then there's also pain generators that are not necessarily protective. Can you still hear me?
Yes, sir.
Okay, just want to make sure. Ready to be. There's also pain generators that are not necessarily protective, but as we all get older and we want a quality of life and have pain reduction, that's really the roundhouse in what we're here for, is quality of life. And I'll give an example of that. You have a 60-year-old male or female who's been active their whole life and has progressive lower back pain, and they just deal with it every day. And I have couples who come in all the time, and usually it would be the husband will come in and say he's fine, and the wife says no, he's not. He's always saying his back hurts. And we get into a conversation, I'll say, well, it sounds like you have an arthritic component to your lower back pain. And as the discussion goes on and we get imaging of the area, they can have something as simple as facet arthropathy, or in layman's terms, we would say osteoarthritis, or inflammation of the small joints in the lower back. And so something we can do for patients, something that's simple, is to do 2 test blocks where we numb up the little nerves that carry pain from the facet joints, the small joints where the arthritis is in the lower back. And we numb up those nerves on 2 separate occasions. And I compare this to if you went to a dentist and said, my tooth hurts, and he numbs up your tooth and the pain goes away. That's kind of what we do for the lower back. They're trials or diagnostic blocks. And if patients get temporary relief, when we perform those nerve blocks, we do what's called radiofrequency ablation, where we take little needles and we burn those little nerves or interrupt the pain signal from those nerves that carry pain from those facet joints where there's arthritis. And that can usually last traditionally 6 to 12 months for patients. And to have that much back pain, and for something that takes approximately 3 to 5 minutes to perform on an outpatient setting, I think that's just one simple example of the thousands of things that we can work with patients for. Other patients come in and they have a history of back surgery and they're not a surgical candidate, but they want to get relief. There are things we can do like spinal cord stimulators that act as if they're pacemakers for your pain. And so that can help modulate or change the way we perceive that pain to get long-term relief in their lower back pain. So many different options for patients. Some are more interested in the biologics, like autologous platelet-rich plasma, where they draw your blood, spin it down, and inject those platelets and growth factors to help repair a joint. So there's just so many different options for patients, and I usually hear the same thing over and over when I talk to patients about a certain treatment, is how come no one's ever told me this? It's a very, very common comment that we get for patients that says, well, no one even told me this is available. And that's why I think it's so critical to come into an area, Payson or surrounding towns, and provide a service that many thousands of people can benefit from, to have a quality of life, so they can continue to live their life without as much pain.
Excellent. Thank you so much.
Yes, it is unfortunate for probably a variety of reasons. Most people, when they go to a doctor or go somewhere with pain, are most likely medicated. And some tests can be done and, different procedures looked at, but I don't think, and from what you're saying, it's not done to the extent as far as looking at the cause, trying to get to the cause of that pain. You go to a much greater extent to identify that cause, correct?
Correct, and there's 2 ways to look at it. There's objectively to say I can identify something that's the cause of the pain, and then there's the patient's subjective pain, because everyone's different, and I always tell patients, pain is like a fingerprint. No 2 are the same. So what I see on imaging and what the patient feels. So they're all very important factors to consider where we're treating the patient, the individual, not just something on imaging or just on a lab. It's important to take in the patient as a whole, their situation, and really serve as the quarterback of their pain, talking to their primary care physician, talking to their surgeon, talking to all the other healthcare providers involved in the process.
And I know Hoyt yesterday, in his busy day where I think you went all over town. You were probably in every corner, on every corner of the town, different meetings and places. But in the morning, he was at Veterans Coffee Time. And in RIM country, there are approximately 7,000 veterans in this area. And that was something he spoke to, was with veterans, you do see a higher percentage or amount of veterans that are dealing with pain and have chronic pain. Do you see that in your practice as well, Dr. Latham?
We do, and we have many patients from the VA that we see as well, and they do very well. It's just surprising by the time I see them, they'll say, I've had this for 10 or 20 years and nothing's been done or something very little. It's just shocking to hear that, that the health care that we need to provide for them and that we want to provide hasn't been provided.
Wow.
And I think that's just so critical to make sure that, Hoyt does a fantastic job is reaching out to the community and giving them the message to say, hey, if you have pain like this, if you're experiencing this, please come by.
Mm-hmm. So I think it would be good to give out the number again. If you want to schedule an appointment or have your doctor, your physician, the office schedule an appointment with Dr. Latham for pain relief management. His number is 928-596-4800, 4800. Again, that's 928-596-4800. Because I'm sure there are a lot of people and veterans in this area that, as you said, Dr. Latham, it's been years that they've been dealing with pain.
We're anxious to take full advantage of Dr. Latham's coming to Payson. So July 24th is his first clinic day, and we're anxious to meet all the needs that we can and fill his schedule and subsequent schedules on the first and third Mondays, and have no one's needs go unaddressed. And we're hoping that this is something we can do for many years ahead.
Mm-hmm. Hopefully, and I believe it's just getting the word out, and people knowing about this service, knowing how to schedule an appointment. I think that's really the key, but I can see this really being utilized, this service, by members in our community. So, well, thank you so much, Dr. Latham, for joining us this morning.
Thank you very much. I appreciate your time. And we look forward to coming to Payson on July 24th and start these services. So we appreciate it very much. Thank you.
Well, we appreciate you coming up here to serve our community. So thank you so much for doing that.
Thanks, Chris. Thanks, Dr. Latham.
All right, and thank you, Hoyt, for coming on today. And thank you for all you do for the community, and especially for getting out and speaking to members of the community, to the veterans group, at the chamber luncheon, the town council meetings. I mean, you're out there letting people in the community know what's happening with Banner, new services that are being provided, and just really doing a great job to communicate and share all of that with the community.
Thank you.
Thank you.
My pleasure, and right back at you.
Oh, hey, very welcome. And thank you, everyone, for listening and watching today. Again, the phone number for Dr. Latham is on our Facebook Live video. You can go see that, watch the video. But again, if you want that number, it's 928-596-4800. And a big thank you also to Desert Financial Credit Union for sponsoring our Community Spotlight program, and to Banner Payson Medical Center for being a sponsor of KRIM Community Radio. Well, you guys, hopefully you will enjoy the rest of your day. Time to get back to the music here on KRIM. But first, going to get a word from the National Weather Service, and I have a feeling they're going to say sunny and getting a little warmer with each day. After that, though, some music from Billy Joel, the Amazing Rhythm Aces, and more. There we go.
Thank you, Dr. Latham.
All right, thank you, Dr. Latham.
You are a